COVID testing continues to be a problem across much of the country, with some people waiting as long as 2 weeks to get a result. And now a top Trump administration official has admitted that we need to do better on testing.
We are never going to be happy with testing until we get turnaround times within 24 hours, and I would be happy with point-of-care testing everywhere. We are not there yet. We are doing everything we can to do that.
The situation is particularly dire in California, where some hospitals and testing centers are quite simply overwhelmed. In parts of Los Angeles, long wait times are hurting Black and Latino populations in particular. So with me now, Dr. Grace Newman, head of the testing program at South Central Family Health Center in LA. So Dr. Newman, thank you so much for being on with me, and thank you for all of the just so necessary work that you guys are doing. I know that, your health center serves thousands of people, but you are not able to test nearly as many people as you would like. You heard Admiral Giroir say that he wants test results in 24 hours. Are you anywhere close to that, A? And B, when you are able to test people, how long does it take for people to get their results?
Yes, those are great questions. And the answer is no, and that's the main issue here. As we wait for testing to get done more than 24 hours, the results coming back, it will diminish the value of the test itself. Patients are very frustrated if they have to wait 14 days or longer, because by that time they either know that they have it or they don't have it.
And then so you're saying it takes, I know that when I was reading about you, and this is the first time I'd actually ever read a quote from a doctor where you are actually having to turn some people away from getting COVID tests, period. And that must be excruciating for you as just a medical professional.
Yes, it breaks my heart, and it's very painful to say, hey, we can't test you, sorry, come back another day, hopefully you'll get tested. It's absolutely heartbreaking, and we should have to fix this problem.
And why is that? Why is that happening? Because of issues with labs and just being overwhelmed?
Yes, labs are overwhelmed with more testing, and because of the increase in the turnaround time, because they need to test more patients as the surge has gone up. So there's limited reagents, there's limited test kits out there, and there's a bottleneck going on.
I read a quote from you. I want to read it to everyone listening. You said, "I feel like COVID-19 is like the Grim Reaper. It goes out and picks on people who are the most vulnerable." And I want to ask you about that, because I know a lot of your patients are Latino. They work in warehouses and factories and restaurants and grocery stores where the risk of catching COVID is so high. Tell me, what are the complications in treating such a vulnerable population?
Yes, that's true. Our patient population is special because of the fact that they are workers in the health and food industries, they're the transportation workers, they are workers in the construction business. Job put them at direct risk because of the need for face-to-face interactions. So because of that, their risk of getting coronavirus is higher. So when they get coronavirus, they will also be disproportionately affected with complications from COVID-19 because they have health issues such as diabetes, hypertension, obesity, chronic lung disease, asthma, COPD, emphysema. So they are at more risk for what we call morbidity and mortality.
It's a funny question to ask, but I'm just curious because I feel you and I feel the difficulty in your work right now. Is it at all rewarding, knowing that you are helping this vulnerable population?
Absolutely. We are talking about helping families, hardworking, low-income families that have 2 to 3 jobs. And if they get sick, who's going to take care of their families? Who's going to provide for them? Their families are not going to be able to eat. If they have to self-isolate for 14 days, they won't have a job. Things like that. This is economic hardship for them. So we feel for them.
We're glad you do, and for all your work. Dr. Grace Newman, South Central Family Health Center in LA. Thank you. Stay healthy. We need you.
Okay,
meantime,